Paul Rivers, Sunshine Coast.
Thank you, Madam Speaker. Madam Speaker, I have an 84-year-old constituent who's suffering from dementia. In July, he was hospitalized because his wife finally conceded she was no longer able to care for him at home, and the police had brought him back after he'd wandered away on 3 separate occasions. Now he's always sedated and usually restrained in a chair. His wife loves the hospital staff and wonders what else are they supposed to do. It's not fair to this man or to his wife or to the staff for this gentleman to be bored, stuck on an acute care ward for 10 months. Does the minister believe this is justifiable?
Minister of Health.
Thank you, Honourable Speaker. Thank you, Honourable Speaker. This is the first time that I've heard of this particular constituent's concerns. As always, I'm willing to work with MLAs to examine the kind of treatment that constituents are receiving in the healthcare system. So I would encourage the member to come and meet with me around that issue. But, Honourable Speaker, this is the government that set up patient care quality offices in every regional health authority to make sure that families and patients have the ability to express their concerns and action would be taken. And that is often the case, Honourable Speaker. So I would encourage the member to come and meet with me, and we will try to resolve the concerns of the family.
Paul Rivers, Sunshine Coast, on a supplemental.
Thank you, Honourable Speaker. And the minister's office has been made aware, and over 2 weeks ago. It's not safe for this gentleman either. He got loose once, and while he did set off the alarms, he was onto the 4th floor and halfway up the ladder to the roof before security found him. And you can't blame him for wanting to get out. He hasn't been outside in 10 months. Does the minister think it's appropriate for an 84-year-old man or any person with dementia to be confined inside a hospital, restrained, often restrained physically, and sedated for 10 months?
Minister of Health.
Thank you, Honourable Speaker. And as I mentioned, I would be happy to work with the member. Dementia patients pose, of course, real challenges for healthcare staff, in terms of provision of the type of facility that helps to ease their anxiety. There are many different programs around the province of British Columbia. We have invested in 6,500 new spaces for residential care. Many of the newer centres, Honourable Speaker, have special dementia wards that will reduce anxiety, that will reduce some of the behaviours associated with dementia in a way that does not rely on the use of medication. But, Honourable Speaker, no one wants their family member to be in that sort of state. I understand that completely, and I'm willing to work with the member for this constituent.
Yeah.